Abstract number 476, entitled Real-World Outcomes and Prognostication of Older Patients with Primary Central Nervous System, or CNS lymphoma, in the Contemporary Era. We know that primary CNS lymphoma is most often an aggressive non-Hodgkin's lymphoma confined to the brain, spine, eyes, and/or leptomeninges, and its most common histology is diffuse large B-cell lymphoma. From epidemiologic data, it appears that overall incidence is increasing, in part due to increasing incidence in older patients. We know from a host of literature that, generally speaking, the treatment of older patients, especially into the 70s and 80s, can be challenging overall due to comorbidities, frailty, etc., and especially in a disease that warrants therapy that crosses the blood-brain barrier in CNS lymphoma, such as high-dose methotrexate and high-dose Ara-C, etc. And there's been a relative lack of published data for older patients in CNS non-Hodgkin's lymphoma. In addition, the impact of geriatric assessments are unclear in patients with CNS lymphoma, and it was something we sought to analyze in this real-world retrospective study across 17 US cancer centers, where we analyzed survival of older patients ages 60 and above with primary CNS lymphoma across a recent 10-year period. We also sought to look at the impact of methotrexate dose, geriatric assessments, as well as start to look at possible prognostication as well. Ultimately, we initially analyzed 500 cases, excluding missing data, et cetera. We ended up with 450 cases that were diagnosed with adequate follow-up without missing data. Of this, the median age was 71 years with a range of 60 to 88.